Welcome back. Thanks for staying with us. Tomorrow is marked as World Diabetes Day. The Healthy Living Alliance is calling on government to utilize all tools at its disposal, including front-of-pack warning labels, to create a healthier food environment and fix the food system for all living in South Africa. It's estimated that almost 4.6 million people between 20 and 79 years old with diabetes in South Africa in 2019, with over 52% undiagnosed. For more on this, we're joined by Nzama Mbalati, Program Director at HEALA. Very good afternoon to you. Thank you so much for your time. South Africans are consuming more ultra-processed foods without even being consciously aware of it sometimes. The foods are high in sugar, salt and saturated fat, which all in all contributes to an alarming increase in the numbers of obesity and higher levels of non-communicable disease rates. What are some of the reasons behind this?
Thank you for the opportunity, Mpo, and good afternoon to the viewers. I think you are very much spot on. Looking at now, we're going into a festive season, right? Festivities is about food coming together, celebratory mode. The biggest issue that we have always had in this country is we do not know what is in the food that we are eating. So from your breakfast cereal to what we're eating at lunch, particularly on packaged food. And there is evidence that is showing the relationship between food and health. So we're going into the World Diabetes Day. We are saying, can government make needed an urgent intervention to support people who live in South Africa to make informed food choices and reduce the consumption of food with high fat, salt, and sugar content. So this is one of the policies that have been proven. There's enough evidence that shows that when people are better informed about the labels, they are most likely, gonna impact on their behavior in terms of how they purchase. Over and above that, we think there's a lot that needs to be done for people to have equitable access to healthy food. And one of the things we've been doing with the health promotion label or the sugar tax was to ask for Treasury to look at, zero rating VAT on some of the most healthy staple food that household needs. So these interventions need to be progressive and needs to be implemented urgently.
What are some of the dangers when it comes to pack warning labels? I mean, what is it that South Africans are missing, or perhaps even the manufacturer is omitting?
So the current model now put information at the back of the pack, which is incomprehensible. So me and you, if we have not studied food or we're not dietitians, it's difficult to know what is 0.5 gram of sodium, for example. So it's a whole long list. The information is there, but if you go into a shop to purchase food, you will not have time, nor even understand, to read each label when you are purchasing. Say you're doing a grocery. Most of the things that we check is just expiry date. So what we need is to have like a simple, comprehensible label that will say, high on sugar, high on salt, high on fat. So the food we are eating from breakfast cereal, for example, which most people, and yogurt, most people think is healthy, actually is high in the threshold of salt, sugar, and fat. And what are the dangers is that it pre-exposes us to health conditions such as diabetes, hypertension, because it increases our obesity rate. And this puts us at risk of developing diabetes, for example, going into World Diabetes Day. So there's a strong relationship of unhealthy food, food with high sugar, fat, and salt content to the health conditions I was talking about.
So with World Diabetes Day under the spotlight, I suppose as you speak about some of the contributing factors, it's important to understand what are the symptoms and the dangers one should look out for.
Yeah, that is very, very important. And I think maybe on that question that you have raised is that there are more people who are actually pre-diabetic. For example, I have a personal experience. My sister is diabetic, and we never had a history in the family. It's showing like more and more people are developing diabetes because of the food we're eating, right? Type 2 diabetes. And it's showing increasingly that, there are a lot of people who, have sometimes maybe a low sugar diabetes, and they will want to consume a lot of sugar in the form of maybe cold drinks, or wanting to eat a lot of chocolates to compensate. And later on then, because our screening rate is also very low, so there are more and more people who are staying at home, who are pre-diabetic, who are about to get diabetes not so long, so it's important that we can increase screening of diabetes in communities, and people can do routine diabetic and glucose level check even when they feel they are fine, because the biggest problem is that this is a slow epidemic, or slow violence as we call it, because you find it over time with the overconsumption of food that you could develop diabetes, as you say.
What will it take then to fix the food system for South Africans? I mean, it's all very well to advocate for a healthy diet, cutting out unprocessed, ultra-processed foods, but when it comes to the state of the country's economy and the poverty levels, which food is more accessible and cheaper, which normally points to deep-fried packet of chips?
And it's true. So these ultra-processed food, these unhealthy food, are made to be palatable and cheaper. And people have few options, because even we are just inundated with food, with unhealthy food. Even when you go to buy food in the supermarket, that what you're gonna get. So it's a pack of chips, it's sweets, it's a cold drink. So I think we need a combination of things to realize for all people to access, healthy food. We need money at the household. So this is linked to job creation. This is linked to social support and protection in the form of grants. This is important also in terms of regulating the food environment. What kind of food can we have access to? I have also spoken about government making direct investment through some of the health taxes that they are collecting, from things like tobacco, alcohol, and the sugar tax, to actually look at zero rating some of the healthy staple food items that people need on a day-to-day. We need to make sure that children and mothers and caregivers do also have some form of support and income. We need to close, the social wage and the social security net to ensure that, people have money there also. So we need a combination of intervention, to actually ensure that people can access healthy food. And we think food regulation is important, because what food you get in contact with, or food that is available close to you and what you can afford, determines the food you purchase and eat.
Yeah, very well. Thank you so much for your time there, Nzama Mbalati, Program Director at HEALA, really just highlighting World Diabetes Day, as well as the impact on health when it comes to accessing food and knowing what and what not to eat.